Hello, and welcome to Health is the Key, the podcast that explores the health and wellness issues that matter to 1199 SEIU healthcare workers. I'm your host, Elizabeth Moore. March is National Kidney Month, so today we're taking the time to celebrate those powerhouses of the human body. Kidneys do so much more than simply filter blood, so when they don't function properly, a problem that affects more than 35 million people in the United States, it can have profound effects. So joining us to explore the wonders of kidneys and ways to keep them healthy is Dr. Kristin Meliambro, an associate professor in the Department of Medicine at the Icahn School of Medicine at Mount Sinai. Dr. Meliambro will share with us the essential work that kidneys do and the simple steps we can take to keep them going strong now and in the future. Welcome to Health is the Key, Dr. Meliambro.
Thank you. Thank you so much for having me.
So if you could just run down some of the tasks that kidneys do for us.
Yeah, absolutely. So, when I was trying to explain it to my older son one time, I saw maybe on a patient education website, they were described as the cleaning crew and inventory managers. So the kidneys absolutely filter the blood. And then through that process and some downstream effects after filtration, the kidneys determine basically the content of what will remain in the blood and what's going to be excreted in the urine. Through that process, they help to regulate electrolytes, acid base, and volume, which is very important to the function of cells and organs separate from the kidney. The kidneys also secrete some hormones that do very important things. So they secrete a hormone that regulates red blood cell production. They secrete a hormone that converts vitamin D into its active form. And you've probably heard a lot about vitamin D all the time in regulating a lot of important functions. One of them is our bone health. There's also a role for vitamin D in immunity. They also secrete other hormones that regulate blood pressure and, contribute to overall normal physiology.
So they really are unsung. These are heroes.
I think so. Yeah, I think so.
You're biased, but that's
a little biased. Yeah.
So can you explain for us, what is kidney disease?
Yeah, what it generally is referring to lower than normal kidney function. That is defined by a blood test. So when you go to the doctor, you may have had something called a basic metabolic panel or chemistry panel drawn. And on that panel, there is a value called the creatinine. The creatinine is a byproduct of muscle breakdown. And then based on the level of creatinine in the blood, it'll tell you the estimated kidney function. So when your kidney function is below a certain level, that is sort of what is used to define the stages of kidney disease. There are 5 stages. 1 is the most mild. 5 is the most severe when we're thinking about people either on or going on something called dialysis. Now, other signs or part of kidney disease, the category, is people may have inflammatory kidney diseases where they have blood and or protein in the urine. So sometimes, especially when those diseases are in the early stage, you may have normal filtration rate, but if you have blood in the urine and protein in the urine, it's a sign that there's damage to that filter barrier because blood and protein should stay in the blood. It shouldn't be going out in the urine.
And one of the scary things is that there are often no symptoms of kidney disease. So the way it is detected is through standard blood work?
Yeah, absolutely. And that's something I think that sometimes is a little frustrating and sometimes even a little hard, for patients to hear because a lot of people will say, but I feel fine. I don't notice anything.
And can you explain a little bit about kidney stones? Do kidney stones indicate kidney disease?
Not necessarily. Okay. So kidney stones are when you have precipitation, often of calcium, and oftentimes it's calcium phosphate or calcium oxalate. And these little crystals deposit in the kidney. Could be in the kidney tissue itself, could be in the ureters, which are the tubes that connect the kidneys to the bladder. Sometimes they're in the bladder themselves. Now, people who have normal kidney function, who have no kidney disease, can develop kidney stones. And generally, if the stones pass, which if they're small, they often do, or even if they're not, and you have to have an intervention to break up the stone or have the stone removed if it's more involved, that doesn't mean that you will have kidney disease. There are some people that develop many kidney stones or have another underlying condition that does, lead to kidney disease. Or if you develop kidney stones that are so bad to the point that they actually obstruct or block the normal flow of urine from the kidney or damage part of the kidney tissue, then that may contribute to kidney disease.
So what causes kidney stones if you have normal kidney function?
Yeah, that's a good question. Some people have predisposing conditions like probably everybody's heard of gout, which is when you have elevated levels of uric acid in the blood, and that forms precipitates or crystals that often settle in joints. Other reasons why people might develop calcium stones, we kind of learn by doing an analysis of all the urine that a person excretes in 24 hours. So they give a 24-hour urine sample. And we can see things like, for example, sometimes there's low levels of a buffer called citrate that can predispose the formation of calcium stones.
Okay.
And so people have to take citrate supplements. Sometimes there's a problem with oxalate absorption from the gut. You don't absorb enough, you excrete too much in the urine, and then that binds with calcium stones.
Okay.
Sometimes people have a problem with the parathyroid hormone gland that regulates calcium levels and calcium absorption, and so too much calcium gets excreted into the urine. And then there's always sometimes the issue of hydration. So absolutely a risk factor for stone formation is having insufficient fluid intake.
I did not know that.
Yeah. We usually encourage people to drink to thirst, but sometimes people will say, I don't drink any water, and I don't like it, I don't drink it. So then that can be a risk factor for stone formation. Other people would drink a seemingly good amount of water, but then if they have the other factors that predispose to stone formation, we'll tell them to increase their fluid intake, like ideally 3 liters or more a day.
Okay.
So between increasing fluid intake and then maybe taking supplements, depending on what their urine analysis shows, we can figure out and potentially try to prevent them from forming more stones in the future.
Okay. And because kidney disease does not present with a lot of symptoms, can we just go over what predisposes someone to kidney disease and who's at risk and what are some of the mitigating factors that can bring on kidney disease?
Absolutely. So the biggest risk factors for kidney disease are underlying conditions. So in the United States and worldwide, diabetes and high blood pressure are the most common causes of kidney disease. There are other systemic diseases that may be associated with those inflammatory diseases of the kidney, like lupus, for example, can lead to a form of kidney disease. There are other types of kidney disease that may develop just in the kidney themselves. And again, oftentimes they're of an inflammatory autoimmune nature. What's been increasingly recognized is that genetic factors may predispose people to kidney disease. So oftentimes if, a patient reports that they have multiple family members that have been affected by kidney disease, and sometimes that also goes along with a family history of high blood pressure, that may point to a genetic factor. We can do genetic testing to see if there is the presence of mutations in certain genes that are associated with kidney disease. Another common risk factor that's, again, of increasing prevalence is obesity. So obesity in and of itself can lead to kidney disease, and oftentimes it's associated with protein in the urine.
And can you explain what is it about obesity that can bring on kidney disease?
Yeah, so there's a couple of different factors. One of them has to do with, when you have obesity, there's sort of an association of enlargement of the parts of the kidney where the blood is filtered, called the glomeruli. And there's also an association with actually hyperfiltration, as they call it. So those glomeruli are doing sort of extra work. And then sometimes they can't keep up with the demands of doing that extra work. And what that can do over time is actually lead to scarring in the parts of the kidneys where that occurs. And when you have scarring, especially at the part of the kidney where the blood is filtered, that can then lead to, again, sort of like a breach in the filtration barrier, especially with protein passing from the blood into the urine. Obesity is, of course, then tied with other risk factors, like, for example, if someone has diabetes, their glucose control may be worse. Same thing with high blood pressure. That may also exacerbate, sort of those conditions that also lead to kidney disease.
Right. And so many times when we talk about things that lead to disease, they're the typical lifestyle thing, like smoking.
Yeah,
like,
smoking is another risk factor.
And why would smoking? Does it increase inflammation? Or
Yeah. So there's damage to blood vessels, including blood vessels that go everywhere, like in the kidney. So sort of like someone who smokes is more prone to developing cardiovascular disease. Smoking oftentimes from the nicotine may raise blood pressure. So it may kind of exacerbate other risk factors that were already present.
Right. So when you had mentioned that early on kidney disease has no symptoms, what are some symptoms that will show up? And unfortunately, it's probably when it's in the later stages.
What can sometimes happen is people start to experience symptoms like loss of energy, fatigue. They might experience nausea, vomiting, loss of appetite. They may notice that they're urinating less than they previously were. And then along with that, they're accumulating fluid in the body. Oftentimes it's in the extremities, especially lower extremities, right? Because they have to work against gravity. So that's where they pool. Other symptoms might be increased sleepiness or disturbed sleep. Also, the patient may seem slower or confused. Another common symptom, people oftentimes describe a funny taste in their mouth, especially a metallic taste.
Do you ever feel actual pain in the kidneys?
Not really. No. So that's another common, I would say, misconception.
Right.
So sometimes people come in and they say, hey, I have this back pain, so I'm worried I have problems with my kidneys. Unless you have something like a stone or like enlarged kidneys because of cyst disease or a rupture of a cyst in that situation, you won't feel pain from kidney disease. Other signs of kidney disease where, maybe, again, even before the function gets very low is if you have one of those inflammatory kidney diseases, you may see blood in the urine. And then when people have a lot of protein in the urine, sometimes they notice that the urine appears more frothy or has more bubbles. Okay. Now, I've also had a lot of people report that when they don't have protein in the urine. So I would say that's not 100%, but sometimes that can be an indicator.
Something to look for.
Yeah.
And I wanted to ask about things that exacerbate kidney function. I recently had surgery, and so I was on a lot of painkillers.
Yeah.
And I'm told that painkillers can, like ibuprofen,
yes.
I think acetaminophen is a little better.
Acetaminophen is better. Yeah. So the class of painkillers that we're generally worried about that may, if taken in high amounts or for a long period of time, lead to kidney disease are the non-steroidal anti-inflammatories or NSAIDs. So that's ibuprofen, Aleve, Advil, higher doses of aspirin, so not a baby aspirin, naproxen, those medications, again, if taken in, over long periods of time, can injure the kidneys. And if you have pre-existing kidney disease, we advise you not to take those medications. Tylenol is safe for the kidneys. Now, the flip side is if you have liver disease, then you have to watch how much Tylenol you take. I mean, again, taking within the recommended amount
Sure.
should be fine.
Mm-hmm.
And then other painkillers, like things like morphine or other opiates, it's not that they in themselves cause kidney disease, but if you have kidney disease, especially if it's pretty advanced, you may have reduced clearance of those medications. And so we worry about the levels of them building up in the blood, which can exacerbate all the side effects of that you would get from those opiate medications.
Okay. So I wanted to ask you a little bit if you could explain the different stages. So one is fairly mild and can be treated fairly easily, and 5 is going on what you had mentioned. So what are 2, 3, and 4, if you could explain
so
those?
2 is pretty mild. 1 and 2 we would say are mild. So you may, again, have it picked up on a blood test, or again, you may have it in the earlier stages of one of those inflammatory type of kidney diseases. And it may not be so much of an issue in function at that point, but again, you may have things like protein in the urine or blood in the urine that have to be addressed.
Okay.
Most patients with chronic kidney disease fall into stage 3, and stage 3 is actually divided into 3A and 3B. So we call the top of stage 3, 3A, is sort of like mildly still reduced kidney function, and then stage 3B is moderately reduced kidney function.
Okay.
But that's where most patients fall. So I know when I say stage 3, everybody's like, oh my God, I'm already halfway through. But the fact of the matter is, sometimes, especially in the past, stage 1 or stage 2 wouldn't even be reported.
Right.
You wouldn't even know that.
Right.
Stage 4, that's advanced kidney disease. And stage 5 is really end-stage kidney disease or end-stage renal disease.
And this might sound like a silly question, but when you have kidney disease, does it affect both kidneys?
No, that's a good question. So oftentimes, especially if we think the kidney disease is due to a systemic disease, or again, one of those sort of intrinsic kidney diseases, we do assume that both kidneys are affected. But there are other situations where you may have sort of a structural, let's say, issue that just affects one kidney. So I mentioned before obstruction of the kidneys, which can commonly be due to stones. You may just have that in one kidney. So then, and there's ways to check for this. We can do certain scans to sort of identify the contribution of each kidney to overall kidney function.
Okay.
And again, we wouldn't know this until we do imaging. Some people are born with one kidney, or some people can have, maybe they have another kidney present, but it's very small and scarred. It didn't develop properly. But again, for most causes of kidney disease, we're going to assume that both kidneys are affected.
So we've talked a lot about symptoms and treatment. So I guess if it's stage 2 or 3, the treatment is...
So actually, oftentimes people don't have to be referred to a nephrologist until, again, unless you have something like protein or blood in the urine, until the kidney function is really what we'd consider stage 3. So a lot of it depends on why we think you have the kidney disease, or again, if we have a biopsy, so we have a very good idea why you have it, trying to control the risk factors. Sometimes the goal would be at least stabilization of kidney function. Sometimes even in, for example, diabetic kidney disease, when we maximize therapy, the kidney function can improve. Depending on sort of where you present in your disease, which is why, regular healthcare, early monitoring and detection is so important. If imaging and chronic laboratory work tells us that this has been going on for a while, we may not be able to improve, but we'll try to prevent any worsening. And a lot of times, again, that has to do with controlling the risk factors, diabetes, high blood pressure. Even if we don't think that high blood pressure is the cause of your kidney disease, there are goal blood pressures for people with chronic kidney disease, especially if they have protein in the urine. People ask a lot about diet. So definitely we said if obesity may be a factor, just trying to maintain a healthy weight or losing weight might be a factor. In terms of diet, so If you have a lot of protein in the urine, or generally if you have kidney disease and you tend to have a diet that's very heavy in meat protein, there is some data that getting your protein from plant sources like legumes, tofu, things that, may actually have better outcomes in terms of kidney disease progression and lowering protein in the urine. And then in other dietary things, I always say, well, let the labs guide us. So if you have advanced kidney disease and you develop high levels of potassium in the blood, then you have to limit foods that contain potassium.
So we've talked about treatment and what happens when you're diagnosed. So can we just talk a little bit about what prevention, like even if you're not at risk for kidney disease, what can you do to keep your kidneys healthy?
I would say, so again, making sure that you get regular health care, making sure you see it's usually a primary care doctor at least once a year, have regular blood work done, and have your blood pressure checked. And then if you have those predisposing risk factors like diabetes and high blood pressure, again, working with whether it's your primary doctor, an endocrinologist to try to get those as under controlled as possible is really key. If you don't have any predisposing risk factors, there's not really a lot of extra measures that you have to do. And I'm going to say one thing that can actually be injurious is when people take all sorts of supplements that are not prescribed, that are not regulated. We have to be very careful because a lot of times they have traces of other elements that are either not disclosed or unknown, the effects, and then they do run into problems. I had a patient the other day who was taking a supplement that then when I looked it up, and there was an FDA warning just from a few months ago that it contained undisclosed doses of an NSAID.
Wow.
So that's very dangerous. Staying hydrated is always good. Again, as we talked about, you don't have to drown yourself in fluids, especially if you don't have a condition like kidney stones. Drink to thirst. If you're someone, again, who doesn't drink any water or tends to drink things like juice and soda, which have sugar, which have salt, and other stuff I don't even know, it's probably good to work in water.
Right.
And again, trying to maintain a healthy weight through healthy food choices, exercise. If you smoke, really, really, really trying to quit.
And one thing we didn't talk about was alcohol.
Yeah, so alcohol generally, alcohol is a major risk factor. And there's actually a lot of interesting research being done now on the crosstalk between different organs. So liver disease can lead to kidney disease and probably vice versa. There may be, a cycle that way. Heart disease can lead to kidney disease. And actually cardiovascular causes are the number one cause of death in patients with kidney disease, especially patients on dialysis. So I would say trying to reduce alcohol content is another just general health measure.
Sure. And one of the things I wanted to talk about when a patient is diagnosed with any stage kidney disease may come as a shock to them because there were no symptoms. Do you find that patients need emotional support? Like, are there support groups for people with kidney disease?
Yeah, so that's a great question. So generally, if patients if they do need that emotional support, it's a big diagnosis. They don't understand it, have a lot of questions, and they want to know, am I the only one? I will direct them to the National Kidney Foundation webpage. They have, like, for example, food lists and a lot of, I think, supportive kidney health measures. I also think nephrologists, kidney doctors, and again, I'm biased, but I think, nephrologists are oftentimes have sort of the same involvement with their patients as primary care doctors do. We spend a lot of time talking. I think, generally nephrologists as a group are good communicators. And a lot of times that, helps to sort of, establish a bridge to let them know that there's support and there is a whole community. There are kidney nutritionists that are associated with some clinics. And definitely for dialysis patients, there's nutritionists or dietitians and social workers that are part of the team. So it is a multidisciplinary team. Same thing for the kidney transplant network.
Okay. And our members have a lot of resources through the benefit funds
Oh,
that they can access through our Healthy Living Resource Centers. So that's really important. Well, that's great. You've left us with so much to think about and things to follow. So is there any last word you'd like to leave with our members?
I think, again, as we said, kidney disease is more prevalent than I think people think. And it's sort of a growing epidemic. Early detection and identification is really key. A lot of people will present at a later stage of their disease, and sometimes there isn't much we can do to go back. So just to whatever extent that you can make sure that you are being checked. Best case scenario, you're told everything's okay, come back. There's never going to be a bad outcome for getting checked too early. It's really too late.
Right.
And hopefully, there are national initiatives like we have the American Society of Nephrology, National Kidney Foundation that, are trying to impress upon everybody the importance of kidney disease, get the word out there.
That's great. Well, you've definitely gotten the word out, and we thank you so much for coming in.
Yeah, absolutely. Thanks for having me.
You heard Dr. Meliambro mention dialysis as a treatment for patients with stage 5 kidney disease. Tune in later this month to our March keynote to hear Dr. Meliambro explain what dialysis involves, the various forms available, and supports that can help make treatment less disruptive to everyday life. For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.